If you find yourself spending a lot of time on social media reading about ADHD, you might start thinking that some of the symptoms match your experiences, like daydreaming, forgetting where you put your keys, or constantly being late for work. ADHD is a hot topic on platforms like TikTok, but it's important to be cautious because the videos can sometimes give the wrong impression. Despite this, some individuals claim that these videos have actually encouraged them to consider getting a proper diagnosis and seeking treatment for ADHD. Approximately 2.5% of adults in the United States have ADHD, a condition characterized by attention deficit or hyperactivity disorder. Unfortunately, ADHD is frequently not correctly identified and treated in adults. According to Dr. David, a professor at Johns Hopkins University School of Medicine, it's not possible to suddenly develop ADHD as an adult if you did not have it as a child. ADHD is a specific disorder that typically begins in childhood or early adolescence and often continues into adulthood. For a healthcare provider to confirm an ADHD diagnosis, certain symptoms must have been present before the age of 12, according to the DSM-5, a mental health diagnostic tool published by the American Psychiatric Association. Dr. Goodman explains that while many adults may experience occasional distraction, forgetfulness, inattention, difficulty following through, or a lack of motivation, these symptoms alone don't constitute ADHD unless they started in childhood or adolescence and are consistent over time. Can excessive social media use cause ADHD? Using social media or technology a lot might increase the chances of teenagers showing symptoms of ADHD, according to some studies. However, there is no proof that adults can develop ADHD from being exposed to too much stimulation. Researchers still don't know exactly what causes ADHD, but they think it might be connected to genetics, exposure to lead, brain injury, or low birth weight. The things in our surroundings that stimulate us can make it harder to pay attention and might make us easily distracted. While this can lead to changes in thinking, it does not actually cause ADHD. Sometimes adults might get diagnosed with ADHD for the first time, and it's often because the condition wasn't identified when they were kids. This usually happens when they are facing challenges or demands in their everyday life that make their symptoms more noticeable. According to Jenny Cowan, a licensed clinical psychologist, this prompts them to figure out what's causing the impact and how to deal with it. So, how is adult ADHD diagnosed? Using online screening tools may provide some insight into a potential diagnosis, but it's challenging for individuals to confirm their credibility, according to Cowan. If you find resonance with ADHD-related posts on social media, don't hesitate to discuss your feelings with a professional specializing in adult ADHD. This expert will conduct a comprehensive evaluation involving an interview with you to understand how symptoms may impact your functioning. While there isn't a definitive test for adult ADHD, mental health professionals can use the DSM-5 and behavior screening tools. The American Professional Society of ADHD and Related Disorders is working on the first U.S. guidelines for adult ADHD diagnosis and treatment to standardize care. Accurate ADHD diagnosis is crucial, as conditions like anxiety and depression can coexist or share symptoms with ADHD. Cowan emphasizes the importance of a skilled diagnostician to avoid inaccurate diagnosis and the risk of being treated for the wrong disorder. Treatment options for adult ADHD include medications, mental health counseling, and behavioral management techniques. Finding a professional with an effective treatment plan allows individuals to focus on aspects of life that bring joy and contentment. So what does this mean for you? If you feel like you are experiencing difficulties in your personal life or work due to possible ADHD symptoms, it's a good idea to talk to your healthcare provider. Share what you have observed, and they might recommend a formal diagnosis based on how much your symptoms are affecting your daily life. So, the following are the key takeaways from this video. Adults with ADHD are frequently misdiagnosed and may not receive the necessary treatment. Contrary to popular belief, there is no proof that using technology or social media causes ADHD in adults. It's crucial for adults to seek the correct diagnosis and treatment because conditions like anxiety and depression often coexist with ADHD. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.